Management meeting for July 11th. I hope everyone's enjoying this lovely summer's morning. Just remind members of the committee of your obligation to declare an interest. Seeing nothing, if anything should arise, you may declare it at that time. We have no delegations this morning. Our first report is the long-term care LTCRCM 12-23 regarding the long-term care director update be received for information. Can I have a mover to get that on the floor, please? Moved by Member Hutchinson and seconded by Member Patterson. Thank you, and we'll turn this over to Jen. Thanks for joining us, Jen, and taking time out of your holidays.
My pleasure. Nice to see everyone. Good morning, committee. I'll just move my notes over so that I can see them. So this report is the director's update of things that have happened since our last meeting. There have been a couple of updates that are really significant in long-term care in regards to COVID. And I think really signifies us moving into post-pandemic new normal and what that looks like. So I'll share a summary of some of that information, and then if there's any questions of anything that I might not have highlighted, we can do that at the end. So at the beginning of the report, just an update on some changes in senior leadership of assistant deputy ministers in the long-term care. But the information that everyone has been really excited about is the pandemic response updates from the province. And those changes came into effect June 30th and July 1st. And the biggest one is the masking requirement for staff, student, volunteers, support workers, caregivers, and visitors. And that is that universal masking is no longer required, and that masking will be based on a point of care risk assessment. That's consistent with our routine practices that have been in place for infection prevention and control for decades. And my understanding is that the day that the masks came off, it was a very joyful day, that there were residents who had never seen the full faces of their caregivers. And so there was lots of smiling, more with mouths, not just eyes. So that was a good day. We do have mask-friendly policies. So if people wish to wear their mask, they can. In addition to that, if residents or their substitute decision maker wants their caregiver for any prolonged period of time to be wearing a mask when they do care, they can make that request as well. And we have a system in place to support that. For caregivers and visitors, masks are recommended but not required. So the big kind of change with this is that caregivers and visitors can now join for dining and share a meal or beverage in communal areas with the residents. And a lot of people, when they visit, they bring treats and snacks for their loved one. And for the last 3.5 years, haven't been able to partake in that kind of breaking bread together. So this was a really positive and appreciated change in the guidance. An update in terms of how often IPAC audits are to be performed, so at least quarterly when we're not in outbreak. Then there was an update on the changes or of the guidance for COVID-19 cases for returning to work. And again, this aligns with our previous policies around infection prevention and control for return to work for influenza, respiratory type symptoms, as well as the gastrointestinal symptoms. We are still able to access rapid antigen testing. And so we can, I think it says somewhere later in this report that we have access to these tests until the end of the year. And so we have quite a stock on hand. And so anytime anyone wishes to do a rapid antigen test, they're welcome to do that. The other big change is the discontinuation of the mandatory COVID-19 vaccination policy. So during the pandemic, the Ministry of Long-Term Care mandated that all long-term care homes were required to have a COVID-19 vaccination policy for all staff agency support workers, student placements, volunteers, and caregivers. And that came into effect on July 1st, 2021. The high uptake of vaccinations has really helped mitigate the severity of our outbreaks, and the province and our community have seen a substantial decline in the number of outbreaks and active resident and staff cases. The vaccination program in our 3 homes was very successful, and we appreciate the team members' dedication and commitment and the support of Committee of Management in us rolling out that policy. We do continue to see COVID-19 cases in the community fluctuate, but the risk of severe outcomes is reduced due to the high immunity rate in the community and the availability of antivirals. So the science and public health guidance no longer requires the need for mandatory vaccination. Over the past few months, we've been monitoring the situation, and many communities around us, and they're listed here, have also discontinued their COVID-19 policies. So we consulted with our local public health. They have no concerns with our homes discontinuing the mandated vaccination policy, and it aligns with the recommendations of the ministry. So that discontinuation came into effect on July 1st. We do continue to strongly encourage everyone to stay up to date with their influenza and COVID-19 vaccinations, and we'll continue to offer them on site to prevent the spread and severe illness. And we are working with our Human Resources Department and our collective bargaining units to determine a path forward for employees that were impacted by the implementation of the mandatory COVID vaccination policy. We held some family updates to virtual family calls to support family members in reviewing these changes. And we also held a special event for family members and caregivers on June 27th. And we had a guest speaker, Deborah Bakhti. And Deborah was an executive in seniors care for 11 years. And also during that time, she was a residence family member 3 times, her husband, her mom, and her dad. And she has written a book, which is available at all of our homes for people to borrow if they wish. We have several copies. And she did this hour-long presentation to support each other through the journey of long-term care. And it was really well received. And we have a recording of that session available for anyone that wants to view it. Infection prevention and control strategies. The IPAC and wellness leads at each home are continuing to collaborate and ensure that we are in compliance with our standards. The executive directors will touch on the outbreaks that have happened during the spring months. And here's the note about we will continue to have access to rapid antigen tests until December 2023. Some updates in the world of finance and long-term care. The accommodation rate changes for residents came into effect on July 1st, and that was communicated to residents and families. It had historically been deferred during the pandemic, and so this is the first increase since the pandemic, and the new co-payment rates are listed here in the report. We continue to work hard providing opportunities for staff training and education. We continue to recruit RNs and RPNs, PSWs, and food service workers. We work actively with student placements and provide opportunities for the colleges in our local areas. Recently, Grey Gables worked with the Southwest Regional Wound Care Program and held 3 skin and wound education sessions for personal support workers. This was a great refresher for staff. All 3 homes have implemented a variety of educational sessions in the home, including topics related to Huntington's disease, gentle persuasive approach, MDS training, mental health, and a geriatric refresher. All 3 of our homes are participating in a program offered by the CLRI, Center for Learning, Research, and Innovation in Long-Term Care, focused on PSW education in living the dementia journey. And this program also provides funds to support tuition and backfill reimbursement so that our team members can participate in the professional development. And at the end of April, we participated in a virtual palliative care education session. We always try to have a lens of recovery and wellness. And we have recently released the June Wellness newsletter. There will be a short update on accreditation in the operational report. A note here is that the work-life survey and resident safety culture survey were released on May 1st for all staff. And the overall completion rate was 40%, which in the land of surveys is a pretty good response. And we are collecting the data and doing an analysis. And that information that we get back helps guide what action plans we will put into place as part of our accreditation process. There continues to be updates on with the Fixing Long-Term Care Act. They're listed here. So some changes in terms of qualifications for cooks and food service workers. And then an update of the policy that was previously called the COVID-19 Emergency Measures Funding Policy has been updated, and that's linked here. And that is really a policy, a program for individuals that were in hospital that were waiting for a basic accommodation, but moved into a preferred accommodation. The process for how that difference in rate was covered by the province, and what happens to get those individuals into the appropriate accommodation. Partnerships are always important, and we continue to nurture those both locally and regionally. I am pleased to say that I was successful in being elected the member at large for a board position with Advantage Ontario. Also, Advantage reached out looking for some support in providing some education sessions. And I had an opportunity to share our experience in Grey County in implementing our emergency management program, and had a chance to be part of a panel of a presentation led by Colliers, project managers focused on capital development. On June 22nd, Rockwood Terraces Associate Director of Care and IPAC and Wellness Lead were honored to be presenters at the Infection Prevention and Control Canada Southwestern Ontario meeting, presenting their program, The Lived Experience of UTI Program Implementation in Long-Term Care. And so pleased to be able to share some of our experience, learn from our colleagues, and have some of our team members and leaders participating in these opportunities as well. And that is I said it was going to be short, and it wasn't really short. That is an update of what's been happening since our last meeting.
Thanks for Jennifer, and certainly on behalf of the committee, congratulations, Advantage Ontario, and the leadership role that Grey County long-term care staff are taking in supporting both Advantage and the whole sector through education and sharing our expertise. So that's great. Any questions from the committee members in regards to Jennifer's report? I'm not seeing any. So
Are you, Mr. Chair?
I had a question.
Sorry, Mr. Warden, go ahead.
No, that's all right. That's all right. Just two quick questions. The first one was regarding the changes in the protocols for COVID-19. Will we continue to screen people at the door, or is that finished as well?
Thank you. Through you, Mr. Chair. Good question, Warden Milne. So somewhere in the last few months, we transitioned from active screening to passive screening. So there's posters and questions that people are to run through before they come into the building, and some instructions if they answer a certain way, and lots of reminders that if you're feeling unwell, to come and visit another time. So it is passive screening, similar to after SARS. So that even before the pandemic, when you went to visit in a long-term care home, on one side of the sign-in book was a series of questions, and on the other, you're signing in the time and who you're visiting. And so we have that in place with some additional posters to support people coming in.
Thank you. And if I might, Mr. Chair, I had a second.
Absolutely.
Inspections of the home from the ministry seem to be a lightning rod right now in the media. Can you give us a little bit, or myself at least, a little bit of perspective on what your thoughts are on the lack of inspections, or perhaps we're being inspected as we should be? I don't know. Thank you.
Yeah, thank you. Through you, Mr. Chair. I know I saw that news story. So despite the numbers, perhaps broadly in the province, we do seem to be being inspected at a rate that we would expect. We are, as expected, we are very transparent. So when if there's an issue or a suspected issue, we do our reporting, and the ministry follows up, sometimes by phone, often in person. So, and when we get to the operational report, Stacy will give an update on some of the inspections that we've had across the 3 homes. So it doesn't seem like it's not as if we haven't seen them in months. We see the inspectors frequently enough.
Okay, thank you.
Any other questions? All right, all in favor of receiving the report? That is carried. Thank you. We will go on to LTC CRCM 1323 long-term care operational report, April 15th to June 14th. Can I have a mover to get that on the floor? Moved by member Keaveney and seconded by Warden Millen. Thank you. And I believe Dana is going to start the operational report. Good morning, Dana.
Good morning, and good morning, everyone. And through you, Mr. Chair, I'm pleased to begin with over our operational review on the quality section. And that starts with the chart. So in your package, you'll find the CI-high indicators for the 4th quarter, which captures data from January to March. And it was released to us at the end of June. You will note the red areas for Grey Gables, particularly related to depression and psychoses. And I just want to highlight that this data, when compared to the provincial average, does appear high. However, we do have the behavioral support transition unit at Grey Gables. So with the residents that we are supporting there, the data does align with some of their unique care needs. And certainly that's where they come to be supported. As far as the other areas, we are really pleased that we continue to sustain positive indicators and make improvements in several areas. Of note is an improvement in worsening stage 2 to 4 pressure ulcers. The improvements reflect a comprehensive review of the skin and wound care program and an increase in resources that we've made available to our teams, as well as ongoing training to support best practice in measures and the measures we've put in place. And Jen alluded to that with the extensive training and the real focus we have on skin and wound. As well, we're working on upstream and the preventative skin care treatment with all departments. So on to some clinical updates. We're working on a new clinical pathway to support resident care. We have been successfully enrolled into the November cohort of the Registered Nurses Association, or RNAO, clinical pathways to support the implementation of their best practice guidelines in all long-term care homes. So the RNAO partnered with Point Click Care, which is our electronic medical record system, to embed the best practice guidelines right in our system to the point of care. So these are pre-built assessment forms that promote standardized assessments to support identifying what the needs are, and also highlighting the best practice intervention, and supports comprehensive documentation. And that helps to guide nurses through each step. The pathways are aligned also with our Residents' Bill of Rights and are designed to improve the quality of care, enhance resident-centered care, because these are individualized care plans. They support us in being regulatory compliant with our regulations. They improve staff efficiency and really reduce the risk of errors. So all of that is quite promising. And from a budget point of view, the project is supported by a Ministry of Long-Term Care funding initiative that became effective April 1st, 2023, and goes on to March 31st, 2025. And so, and then on to, as Jen alluded to, working to our new normal. It's been a lot of changes, but a lot of positive changes with regard to transitioning into our new normal. And we are working on balancing IPAC measures. We certainly have experienced really strict IPAC measures, but how do we balance that in this new normal with the quality of resident life being the forefront? To support this, we have adopted an IPAC ethical framework called IDEAS. It was a joint effort of Sunnybrook Hospital and North Toronto, Ontario Health Team, and has been shared with all long-term care homes across the province as an opportunity to implement a framework to support us in making clinical decisions relating to IPAC. And it is a requirement in the Fixing Long-Term Care Home Act that an IPAC program use an ethical framework to inform decision-making as we work through IPAC-specific ethical issues and their impact on residents and families and on staff. And it includes 8 ethical principles: fairness, equity, transparency, looking at the evidence, consideration of our IPAC decisions on resident and staff. The quality of life for our residents is always the primary driver in this ethical framework. And then risk relative to reward in our key decision. And obviously safety as the 8th principle oversees that. And it aligns with our Color It philosophy as well. So it is a good alignment. So we've received training on how to use this framework, and we had the opportunity to implement the new framework to support a recent IPAC related decision. And we did that with the staff, with a resident involved in the decision making, as well as a family member, and we worked successfully through the tool. So balancing IPAC measures with quality of life isn't straightforward, but we're working to make it as normal as we can, and the framework sets us up to make the right ethical choice.
Thanks very much, Dana. And thanks for pointing out the behavioral support unit at Grey Gables.
Mm-hmm.
Just wondering, is there any way that unit could be, taken out, of the quality assurance measures so that we are measuring apples to apples when we look at this report? Because as you mentioned, it does increase the amount of red at Grey Gables, which, a lot of that probably can be related to that unit. So I'm just wondering, when the public sees this, it doesn't really indicate that the behavioral support unit is maybe raising some of those quality assurance issues?
So I think, and I might look a little bit to Shannon and Jen to help me out in terms of the reporting requirements that we have with BSO. So we are able to report very specifically on this unit related to what we need to report to the province. But you're right, that forward facing for CIHI, I think it's very difficult to pull that data out. We have explored that, but we've looked with Renata, who's our quality specialist, but I don't believe that as we report to CIHI that's an ability, because they pull it from the back end, as I understand. But I'm going to look to Shannon and Jen maybe okay, Jen. Yeah.
Thanks. Yeah, no, thanks. And through you, Mr. Chair, this data that you see, that we all see on this chart, is the publicly reported data, and it is sent to us by CIHI. So we could look internally with some of our raw data to provide some balancing information in reports going forward. But this is what the public sees. This is what CIHI provides to us. Between now and our next meeting, we could do some inquiries to see if there's a way to carve it out, or if that's something that has been supported in any other behavioral support transition unit through CIHI.
Okay, thank you. Shannon, I saw you nodding. Was there anything that you wanted to add?
No, they answered it. That's good.
Okay, thank you.
Thank you.
Any other questions of Dana's update from committee members?
Yes.
Yes, go ahead, Sue.
Thank you, Mr. Chair. Dana, please remind me, how many beds are in the behavioral unit, and are they included within the overall number of beds of Grey Gables? And is there a waiting list for those?
Well, those are great questions, and through you, Mr. Chair, I am going to defer to Shannon, who will, as the ED. I believe I have the latest numbers in terms of our percentage, but there may have been an additional move-in since I last saw them. So Shannon will give you the most accurate.
Go ahead, Shannon.
Oh yeah, thank you, through you, Mr. Chair. So we still have one empty bed. So we're at 17 in the BSTU. There's only one person on the waiting list, but we're looking for a female bed to share a room. So we're still waiting at this moment. Oh, and Jen, I guess.
If I might,
Yes,
Mr.
go ahead,
Chair,
Jen.
I'll just add that we have some meetings scheduled in the coming weeks with Ontario Health West and Home and Community Care Support Services, formerly CCAC, to just revisit the wait list for the Behavioral Support Transition Unit and the wait list for the interim beds. So we have 3 interim beds, 2 at Rockwood Terrace, 1 at Lee Manor, that are to support the access and flow for patients that have been designated alternate level of care, ALC. And those individuals require a separate wait list. And we're just sorting through some seemingly disconnect between wait lists and admissions. So we have some meetings set up in the coming weeks to sort that out.
Thanks. And if I may, Mr. Chair, and those beds are included in the overall number at Grey Gables. Right. Thank you.
Any other questions of Dana before we go on? All right, we'll turn it over to Stacy. Good morning, Stacy. You're looking after the next part of the report.
I am so. Good morning, everyone. Through you, Mr. Chair, I'll provide a summary on the ministry inspections, outbreaks, and some of the fun activities that residents have been enjoying here at Lee Manor. In regards to the ministry inspections, both Lee Manor and Rockwood Terrace had ministry inspectors on site for over a week to follow up to a complaint and critical incidents in both cases. Inspectors made observations, reviewed records, conducted interviews, and utilized inspection protocols as part of their investigation. At Lee Manor, the final inspection report indicated no findings of non-compliance. At Rockwood Terrace, 3 written notifications were issued related to the critical incidents. 2 notifications related to failure to comply with the Falls Prevention and Management Program procedures, and the other involved failure to implement the developed strategies to respond to a resident's behaviors. All areas of non-compliance were addressed by the Rockwood Terrace nursing leadership team at the time of the occurrence and have been rectified with staff education and training. Moving on to the outbreaks, both Lee Manor and Rockwood Terrace experienced outbreaks during the reporting period. At Lee Manor, a COVID-19 outbreak was declared on Home Area 2 North on May 3rd by Public Health. The variant identified was Omicron B11529, which is highly transmissible. And additional cases were identified in the immediate days following the initial outbreak, impacting all home areas with the exception of 3 South. And the outbreak affected 55 residents in total. Rockwood Terrace was also experienced a COVID-19 outbreak, which was declared on May 15th, affecting 19 residents. Later on May 31st, a gastrointestinal outbreak was also declared, affecting 9 residents. And the Rockwood team worked very quickly to reduce the spread and contained both of the outbreaks to their 3rd floor home area. And finally, in regards to events, all of our care communities utilize resident and family input, along with the expertise and skill of our dedicated team of recreation staff to design meaningful recreation opportunities for resident engagement. And in reading all of the happenings around the homes, it's clear that lots of fun was to be had. The highlight at Lee Manor was a road trip through Florida that involved a full theme week of Florida excursions and activities, and the dietary department was very happy to join in and prepared themed meals, treats, and staff made it really extra special by dressing up as Disney characters for the week. And having that full team approach to remote resident engagement is one of the many reasons why that makes our care community so special. And through me, Mr. Chair, if there's any questions, I'd be happy to do my best to answer them.
Thanks, Stacy. It's always nice to see these different theme weeks that the homes have and how much the residents enjoy that. Questions from committee members? Warden Millen, go ahead.
Thank you, Mr. Chair, and thank you, Stacy, for that report. I'm looking at the section of about people. I note the number of staff onboarded. How are we doing for staffing levels at our homes? I expect we're shorthanded, but are we getting better, worse in terms of optimum levels of staff?
Who wants to take that one?
I can start, and then if Stacy wants to speak to her home, I think it's the one that comes to mind as a really good news story. So through you, Mr. Chair, thank you, Warden Milne. Overall, it's feeling better and hopeful. So we are onboarding more than are leaving. So this is a good trend in the right direction. We are receiving more resumes and applications. The programs that are offered through the province and the colleges seem to have a good uptake from students, and we continue to have lots of students in our homes. So this is it's feeling very positive. And the timing is good because the funding for the COVID measures, the COVID response and prevention measures that help support, we use those funds to support the care support assistance roles. That funding ended, and so we don't have as many opportunities for CSAs. And the goal was to onboard CSAs to then become hopefully in love with working in the care sector, and then we could help them find what their passion is. Is it personal support worker, registered nurse? Is it food service worker? Is it housekeeping? Is it recreation? Because a CSA had a chance to get a taste for all of those opportunities and either decide this isn't for me, but many of them did decide to go back and take a PSW program or do the food service program or go into recreation. So the timing of that shift has worked out. And I believe we're at a stage where we're receiving enough resumes that it's becoming difficult to schedule all of the interviews. Stacy, is that what I heard from the Lee Manor team?
Yeah, I think I don't really have anything to add, just that we're feeling very optimistic and hopeful. And I think our staff are actually in a good place too and feel supported with the number of human resources that we're onboarding. So I think overall it's positive. We're moving in a positive direction.
Yeah, I will balance that. It doesn't mean we're not working shorthanded still, day to day, week to week, but it is getting better. And our goal is to have enough team members with consistent, predictable work so that we're fully staffed every day and people have a job they like, that they can count on, and that they attend work and feel that they have the tools and the support they need to do their job.
I like that. I really like that last statement, Jennifer, and certainly that's the goal, I'm sure. And I appreciate the information. I truly do. In particular, the note about the education programs that have been started in the last year or so through the pandemic seem to be bearing fruit. So excellent. Thank you so much.
Yeah, that's great news to hear. We're moving in the right direction. It's nice to certainly a compliment to everyone joining us today. And the HR team for the added enhancements that we brought in. And Jennifer, are you able to tell us what a full complement currently would be in long-term care and the number of staff that we're sitting at, so that the committee has some idea of how much more work there is to do to get to where the optimal point?
Thank you. Good question. I don't think I can give you numbers. I know I can't off the top of my head. It is information that I can gather. And as you can see from the chart, it's an ever-changing kind of target. So there, perhaps we could bring a report specifically about recruitment and retention and the efforts that have happened during the pandemic, and then what is still to come to an upcoming meeting. And I can collaborate with Director Moreau on providing some of that information. I think because we need to kind of take a breath and see what work is still left to do. It's during the pandemic, there's been a lot of catching up and replacing vacancies and then having more vacancies. And so if that's the desire of committee, that might be an opportunity to talk about this more in depth.
I mean, I guess I look to the committee members. We've certainly talked over the last couple of years, you know, about the number of part-timers, and I know we've done work, you know, so I think that would be valuable information for the committee just to get an overall view on where staffing is and where we need to get to. What are people's thoughts? I see Warden, go ahead.
I agree. I think that's Jennifer nailed it there, where, you know, there's been a lot of innovating, a lot of good work go on over the pandemic, but she's right. I think that there's time to stop, take a breath, and see what's working, what's not working, what more could we do, can we do, and I would love to see a report of that nature.
Okay. Well, at your convenience, Jen, because we want you to all breathe. So, you know, at your convenience, please bring that back when it suits. All right, moving on. Shannon's going to complete the report. Good morning, Shannon.
Good morning. Thank you. And good morning, everybody. Through you, Mr. Chair. So as you said, I'm going to report on the last half of this report. So during this reporting period, the residents were kept busy celebrating programs such as the Spring Fling, Cinco de Mayo, Mother's Day, and Father's Day. In Markdale, the residents participated in the community yard sale, and the residents of Rockwood Terrace, who participated in the Grand Pal program, were excited to receive their gifts from their pen pals. That was a short video with a personalized message. The residents of our care communities have the opportunity to attend any program they wish, and having entertainment or programs daily, morning and evening, allows for a variety of programs such as painting, music programs, road trips, concerts, antique car shows. We've had pub nights and games, just to name a few. Lee Manor and Rockwood Terrace both have public health inspections of the kitchen. Rockwood Terrace also had inspections on IPAC and the hair salon. Rockwood Terrace had 4 areas of non-compliance, and Lee Manor had no violations. All non-compliance issues have been addressed and in the process of being corrected. Our emergency code drills or practices continue in all our care communities each month and are on track for being all reviewed by the end of the year. All 3 care communities have resident and family council meetings with a focus on reviewing quality improvement plans. Grey Gables was proud to host the King's Coronation celebration on May 7th. This was organized by the Grey Highlands Peace Committee. This celebration proved how much a part of the community Grey Gables is. It was really nice having all the people in attendance, and that we didn't have or let the rainy weather impact our celebration. Through Color It relationships, when Lee Manor required gowns for their outbreak, Rockwood Terrace was able to assist. When in turn Rockwood Terrace needed gowns, Grey Gables and the paramedic services came to the rescue. So deliveries were done by team members and by the use of the social services van. It's so nice to see all the Grey County partners coloring it for each other. And that's the end of the report. I can take questions.
All right, thank you very much, Shannon. Nice to see that the warden attended, and Councillor Nielsen was also there for I think the coronation event. So thank you for that. Warden Millen, go ahead.
Just a quick comment, it's not often I am on the list of distinguished guests, but nonetheless, it was a great event and I really enjoyed it. Kudos to the staff and the committee that organized it.
Well, it was similar to your coronation as the warden.
Oh, it far outpaced anything that I've ever attended in the past, that's for sure.
All right, committee members, any questions on Shannon's part of the report? Not seeing any, so we'll call the question. All in favor of receiving? Thank you. That is carried. We now have LTCRCM 14-23, the long-term care financial report as of April 30th, 2023. Can I have a mover to get this on the floor, please? Moved by Councillor Patterson and seconded by, I think, did I see Councillor Hutchison's hand there? I think I did. All right, Marcus, we'll turn it over to you.
Thank you, Mr. Chair. Thank you, committee, for taking this time to review this. This report here is the financial update as of April 30th, 2023. So this is a comparison of our budget for each of the care communities, typically at their year-to-date amounts against the actuals that meet that level of April 30th. We are emphasizing with this report, as we do every year for the April 30th one, is that this report is a snapshot in time, and as the year progresses, these numbers can change quite drastically, because with us only having 4 months worth of information, we only have 4 months of ministry funding, which is quite sporadic during that time. We also deal with the fact that we don't have the summer, which results more in staffing shortages and vacation times, unanticipated repairs with our products and that, infectious disease outbreaks. All these things drastically can change the financial outlook. So with it being April 30th, this very much is a snapshot that we don't put it as to say this is exactly how the rest of the year may continue, because it's at a different things happen at this time of year than they will later in October or November, so to speak. So going into the background and discussion, so there's numerous ministry initiatives that also play into a large swing into how these numbers will look, mainly the direct care hours, overall resident care levels, supplement PSW and registered staff wages. And all of these ones are tied basically from the ministry, and they change on a dime as of April, because that's the new fiscal year with the ministry. So therefore their funding amounts will change. We also see that they don't get the funding all the amounts in April as to what we can expect for the full year. Typically we'll receive a smaller amount or the same amount that we've been receiving, and then in July or June or July we receive a retro back to April. So we also don't see it clear as day with that. So some budget impacts and assumptions. We have 85% of the operating budget is comprised of salaries and wages, as you're all aware of. These lines are based on a number of assumptions, including hours required for backfill of staff on vacation. There's illness, training, modified duty, and they're all impacted by working short staff, modified duty, WSIB claims. Filling shifts at overtime rates or other use of agency staff can also drastically change the budgets. And as we approach going into the summer with the more of the time when vacation is actually taken and that kind of stuff, that's where we'll start to see more of the swing, and that's what we kind of have to wait to see on that. The 2023 budget was developed with the assumption of a 1.5% global level of care increase that was effective April 1st. Funding has been received equal to the amount of the budget. Ministry funding increased to the nursing personal care programs and support services and raw food funding envelopes have been received in June, retroactive to April. So the impact of these increases is being reviewed in comparison to amounts budgeted and will be discussed with the care homes. Funding analysis will be provided in the next financial update. So that's another one that was a retro post this and that, and we then sit to actually make sure that whatever they've retroed is indeed correct, and that we make sure that we've got it evenly budgeted for the remainder of the year. Impact of inflation and supply chain shortages are being experienced and range from increased costs. There's staffing, recruitment, and retention that we have that we've already discussed about, and the ability to source products and challenges, including obtaining contractors for jobs. So reaching out to get tenders for our various capital projects. We've been so far fortunate, but it has been a problem that's existed across the county when it's looking for 3, but you only get 2, and so on. But our purchasing department has been amazing to work with to make sure that we can get these through. Again, we have it emphasized here that due to how early the snapshot is taken in the year, multiple internal transfers and cost allocations have not yet been recorded. So these ones are our interfunctional transfers, i.e. when IT transfers out its costs related to long-term care. That's done on that's not done on a monthly basis. That's done on a by period. So those ones aren't in there. Our insurance for the entire county isn't in yet. So then that part isn't costed out. So there's a lot of those larger accounts that we then spread out that long-term care would receive that just haven't happened yet this far in the year. Going into each of the areas. So starting with long-term care administration. So this fund is the director of long-term care, budget including an accreditation and quality specialist, clinical specialist, support services and education coordinator, administration and human resources support. The cost of this department is funded through the care homes on a budget, and it's based on a per bed allocation, and therefore it's expected to end the year on budget. So as you can see, if you were to look at the attached FRX pages of the financials, you can see that they're basically break even because the costs of the LTC administration have already been spread out for the 4 months to each of the homes as an admin charge on the other ones. So that one has already been done with that. Moving to Grey Gables, their operating spending is currently less than year-to-date budget. Grey Gables is currently they're over year-to-date budget when it comes to capital due to the unbudgeted boiler replacement that was approved by the committee in November 2022 and tendered in January. This project will require funding from reserves at year end of $329,239. Other projects in Grey Gables are in progress and remain in budget. So they operate, their operations are stable and good as of at this point. The only one, of course, is the boiler project, which is of note, which we've discussed before. Lee Manor's operating spending is currently under year-to-date budget, so they are operating at a good level. With that regards, the hot water tank that was scheduled for replacement in 2026 in the capital realm will require replacement this year, which a report is next to discuss about. The capital budget in 2024 will be realigned to reflect these changes. In the other capital for Lee Manor, they are performing well, and they are expected to remain on budget for the remaining capital projects. Rockwood Terrace operating spending is less than year-to-date budget as well, and their capital aspect is anticipated to end the year on target. Of course, with Rockwood Terrace, it's again the unique one that there's a need to provide a safe, comfortable environment while balancing the need to redevelopment with the capital project. So again, they're only taking ones as they are necessary and being very mindful of the useful or operating life of those projects to make sure that we're not about to dispose of something 25% of it way through its useful life, and we could just extend it for the next couple of years for the redevelopment, if it, of course possible. We're not jeopardizing any sort of safety or comfortability. Moving over to the COVID-19 impacts, this section has been in here for obviously quite a numerous amount of reports, and for those who've been on the committee for a while, you can see that these numbers are quite a bit less than what they have been in the past. So the COVID-19 pandemic continues to have significant impact on the operations of the long-term care department. Expenditures related to COVID-19 include increased spending related to additional staff, personal protective equipment, cleaning supplies, equipment to support infection prevention and control measures, screening and testing initiatives. Of course, as Jen mentioned in her report, a lot of these things are being phased out, but we still have some of these costs, especially carrying from the January to March, which was reflective of the last year's ministry's fiscal. So we still had quite a bit of funding to apply to these expenditures and that. So when we look at this, you can see that for January to April, Grey Gables spent $137,200. Lee Manor 166,700, Rockwood 105,000 for a total of 408,900. These numbers are higher than what we will be seeing for the remainder of the year, just because we did have ministry funding to allocate an earmark, and there was still the directives to do these things. Obviously, now with the passive screening with numerous less outbreaks, that sort of one, we are already seeing that these costs are dropping quite drastically, and that's also because we have to put those costs into our operating now. The ministry does not have a special funding for us to submit these expenses to get it back for COVID. So we're going to see a little bit of an increase in the nursing and personal care when these costs go in there. However, it won't be a dollar for dollar transfer, as these costs just in general have been on the decline. Again, we mentioned here that the funding ended March 31st. Operating procedures related to COVID have been discontinued to align with the ending of the funding. So we mentioned that as of May 1st, if the homes experience COVID outbreaks, the costs are associated with the outbreak will impact the operating budget. So again, it's what we've already discussed with that. Cost containment measures. Long-term care staff continue to work closely with staff and finance, human resources, and purchasing to ensure responsible emergency response funding. Through the remainder of the year, staff will consider opportunities to help mitigate costs while ensuring a safe environment is provided for residents and staff. Again, the executive directors and their team have been in constant communication with finance, with HR, and purchasing on a monthly, sometimes weekly basis to go over certain changes in that, to make sure that we've made sure that we have the funding and that all of the measures that we're taking are underway. The big commending again is especially with our capital, when we meet on a monthly basis with purchasing, we make sure that we are sitting that everything is tracked and that everything is on track, and that, which is obviously one that can cause quite a large swing. So it's again a good commending to the teams to make sure that we are progressing and keeping things as stable as we can, and obviously a 24-hour facility. Finally, then financial resource and implications. 3 care homes anticipate that the operating budgets are sufficient for the year. The unanticipated boiler replacement at Grey Gables and then this water tank that will be discussed at Lee Manor will require funding to be identified prior to year end. Again, just to emphasize, you can look at the financial statements that are attached in that. You can see that currently we are showing over $550,000 under budget in that. That again is because we're in a snapshot in time. The ministry revenues haven't leveled out to be, especially from January to April, they haven't leveled out to being what we normally expect on a monthly basis. We haven't seen the staff taking their vacation, so we haven't seen the increase in agency or overtimes for those periods, or also we haven't seen, knock on wood, the unexpected repairs really flare up or anything like that. So this again is a snapshot that's quite early, but again, still good to see that even for that early period and that kind of stuff, they're operating well, and they're operating the same as they have with the same margins and that as they have in previous years. So this isn't that we're starting further behind or further ahead than any prior years at this point too. Again, and then finally we have in here that some entries are outstanding for items such as the reserve transfers, the grant reconciliations, debt payments, all that kind of stuff. But if there are any questions from the committee, I'm happy to answer, to give any sort of any insight you might wish to hear.
Thanks very much, Marcus, for that update. Questions from committee members? Warden Millen, go ahead.
Thank you, Mr. Chair, and thank you, Marcus. I want to ask about the COVID-19 funding from the province. Is it current as to our requirements or our, I don't want to use the word entitlement, but of what we are due, I suppose, is a better way of maybe saying it?
Yeah, so the 408,900 that was spent, and that was again primarily, like the overwhelming majority of that was between the January to March period, because that was when the funding that we had from the ministry was eligible. So those were the costs that were associated with that funding. Again, with what requirements the ministry had at the time, for instance, the screening, the additional cleaning, those kind of measures and that kind of stuff, we were covering our expenses when it came to the COVID expenditures. Now with the funding ending and us adjusting our staffing levels or our measures back to like regular operating pre-COVID and all that, with still some increase in that, we're still seeing to make sure that we have enough, and that it's hard still with it being now just about July. We haven't received our June funding announcement yet, so we need to see where that kind of is to start to level off to make sure that we're covered in that. But at least for what's reported in the report, yeah, we did cover all of our expenses when it came to the COVID side of it.
Thank you.
Other questions from committee members? Seeing none, again, thank you, Marcus, for that update. And we look forward to our future updates where we drill down a little bit deeper as you get more information. And all in favor of receiving the report? That is carried. Thank you. We now have LTCRCM 15-23, the domestic hot water tank replacement at Lee Manor. Can I have a mover, please, for that? Moved by Councillor Nielsen, seconded by Councillor Keaveney. And I think, Stacy, you're looking after this report, are you?
I am so. Yes,
Okay.
thank you.
Floor is
Through you, Mr. Chair. Yeah, thank you. So just a little background and discussion. Lee Manor had a new hot water tank installed back in 2008 and a leak repaired in the tank in 2021. Recently, issues with the hot water tank are occurring again. All applicable warranties have expired, and consultation with a trusted HVAC supplier technician for high-level costing and timing resulted in the recommendation to purchase and install a new hot water tank of the same make and model. Changing suppliers would require additional configuration costs. To meet the operational needs of the home while investigations into a solution were completed, a temporary bypass was implemented, and the home has been operating with the bypass in place for almost 2 months. In terms of the financial and resource implications, this is an unbudgeted project that will cost approximately $87,275, which includes the installation. The estimated total, including applicable taxes, is $98,620.75, and the approximate delivery time for a new tank is 6 to 12 weeks. The project was budgeted in the 10-year capital for a 2026 replacement at the value of $168,900. And discussion with the building services supervisor indicates that this project scope is equivalent to the project slated for 2026. The larger cost in 2026 was in order to upgrade to an on-demand water system. However, with discussions with trusted contractors, our current system is highly energy efficient and minimal improvements would be seen with the on-demand system. This results in overall savings of an estimated $70,280. Funding for this project would come from the Lee Manor Capital Reserves, which have enough funds to fund this project in advance of the slated 2026 date.
Thanks very much, Stacy, and really appreciate the team looking at the differences between on-demand and the current system and being able to come up with these savings. That's great that you're digging down into that and making sure we're putting in what's in the best interest of both the residents and the taxpayers. So thank you. Questions from committee members? All in favor of this report? That is carried. Thank you.
Thank you.
We have no closed meeting matters today. That's always nice. Correspondence. We have correspondence from the city of Stratford. Can I have a mover to put that on the floor, please? Moved by Councillor Nielsen, seconded by Councillor Hutchinson. Who wants to speak to this? Jennifer, go ahead, please.
Sure. Thank you, Mr. Chair. So there's this correspondence, and the other letter of correspondence is related to this letter. So I don't know, Deputy Clerk Goldrup might be able to let us know whether we can bundle those together.
Sarah, are we able to bundle those? They are speaking to the same thing.
Absolutely.
Thank you.
Okay, so
All right. We'll bundle
Sarah.
them together, Jen.
Okay, thank you. So these letters of correspondence are related to the use of long-term care funds, primarily beds in abeyance funds is what's being discussed. And it came from a discussion that happened at Stratford, at a Stratford City Council. And then the Seniors for Social Action Ontario and Council on Aging has also written a similar letter related to the motion by the town of Stratford to write the Ontario Ministries of Health and Long-Term Care, urging them to redirect funding from long-term care institutions to in-home and community-based care, which is where elders and people with disabilities want to be. And there's a linked article as well in the correspondence. And so we've received this correspondence, and I did some investigations and a little bit of follow-up with our partners at Ontario Health West, which is formerly the LHIN, to really confirm and clarify how funds are used for beds in abeyance. And so I'll share that information, and then if committee has questions, and then leave it to committee to determine the next best steps. So beds in abeyance are, in this case, it's referring to the People Care Stratford home that I believed had a flood and then is in the process of doing some redevelopment. And so when those beds are closed, the funding continues to flow or to be held by the Ministry of Long-Term Care. It doesn't go to People Care or the operator who are not utilizing those beds. It's held by the Ministry of Long-Term Care. And the Ontario Health, or formerly the LHIN, will make application to the Ministry of Long-Term Care to reinvest those funds into care and service within the communities. And those application goes to the Ministry of Long-Term Care and must be approved by the Ministry of Long-Term Care. And those funds are reinvested in the long-term care sector. Historically, there's been no crossover into other sectors like community services, for example. And to give you some examples of how those funds like that have been used or invested in Grey Bruce, even recently. So there's a local priorities funding, which supports, for example, the funds for the 3 interim beds to support residents or patients that are ALC to be able to transition into long-term care. And so Grey County has 3 of those interim beds. The BSTU pilot is funded through Ontario Health West, approved through the Ministry of Long-Term Care. Medically complex patient funding, so that would be staffing support and equipment, for example. Programs related to emergency room diversion. So a number of long-term care homes in Grey Bruce applied and received funding for bladder scanners and the purchase of bariatric equipment. And so those are some examples of how those funds are reinvested into the long-term care sector to support care and service for individuals using long-term care services. So I wanted to share that information back with you. I'm not sure, maybe Kim, you want to comment on whether is it appropriate for me to make a recommendation to committee, or what's the step in terms of whether they just receive this correspondence for information, and if you have questions as to whether or not you wish to do anything further based on the information you have.
Thanks, Jen. Good morning, Kim. You're on mute, Kim.
There we are. I apologize. I think certainly for the local Council on Aging, Grey Bruce, that they would benefit from receiving a letter back from Jen that explains how the beds and abeyance funding is used in the community. I think their concern is that I think they're not aware actually of how that funding is playing out in the community, and this would go some way towards allaying any concerns that somehow beds and abeyance funding, which is meant for a particular area, is somehow lost to us, and that's, I think, given Jen's comments, that's not the case, and so we could provide that information to them. Certainly, there's a lot to be said for additional funding for community care services, as we discussed at the last Community Services Committee. And so I think that in some ways is almost a separate issue to this one. But I that's what my recommendation would be, is that Jen provides some additional clarity, and perhaps we could go so far as to comment that we are looking into further discussions with the province about community care services.
Thanks, Kim. I appreciate, the feedback from both yourself and from Jennifer. When I read this, it did feel like it was robbing Peter to pay Paul. And I'm glad Jennifer was able to confirm that these funds are going back into the long-term care sector. Without a question, we need to have provincial dollars for aging and home, and people that are able to, we need to be able to support that. It doesn't take away from the chronic illnesses that others will have and will require the long-term care sector. So anyways, those are just my comments. So is what I'm hearing is we received this for information, but the committee asked that Jen forward a letter to the Grey Bruce chapter outlining how those funds are being currently used within the sector. Other comments from committee members? Councillor Nielsen, go ahead.
Forgive me, Chair Mackey. I'm just trying to make sure that I'm fully understanding what we're discussing. So the abeyance funding is funding for beds that are supposed to exist, but for some reason maybe don't exist, be it construction isn't complete or a home has been taken down for any kind of number of reasons. And then that money being redirected within long-term care itself, rather than having the province just hold the money, which is obviously if they've, put money towards a certain area. The request is to have that money sent into at-home care. I am fully understanding. I'm seeing Jennifer nod, which is helpful. Just want to make sure that I am fully comprehending what the discussion is. And I kind of agree, Chair Mackey, with your statement. Then, you're trying to take the funding out of long-term care, which realistically speaking, we know is lacking anyways, to try to cover another sector, which does need funding. But yeah, I kind of understand that rob Peter to pay Paul kind of sentiment in terms of the request. Thank you. I'm just making sure I'm on the same page as everybody. I
saw both Kim and Jennifer nodding to your commentary on that, Councillor Nielsen. So I think you basically hit it. Any other questions from committee members? My only other thought is, I need to have a better understanding about what care in the community is going to look like, because what we expect it to be and what is actually happening, out there in real life doesn't seem to be in parallel. But anyways, I think we're going to receive this for information. That's a recommendation, and Jen will forward a letter to the Seniors and Social Action Committee of Grey Bruce on aging with a little more definitive information. So all in favor of that? That is carried. Thank you. Other business. Kim, anything from our CAO in other business?
I don't think so at this time. I'm appreciating all of the work that the staff are doing. Of course, summertime is a time where there's a lot of challenges that they're kind of pulling at each other, right? People need their time away. Families want to come and visit. We're trying so hard to keep everyone healthy and safe, and there's a lot going on. But I'm really grateful to the team who are doing a wonderful job of keeping the wheels on the bus and everybody moving forward. So all's good.
Thank you very much. Yes, the team has been doing a great job over the last number of years, keeping the wheels inflated. So we're very happy for all that dedicated hard work. Is there anything else from committee members? Our next meeting is scheduled for September 12th at 2023 at 9 a.m. So I'll take a final motion. Moved by Councillor Patterson, seconded by Councillor Nielsen, that we adjourn. All in favor? That is carried. Thanks very much all, and I hope you enjoy the rest of your summer until we see one another again in September. Well, some of us will see one another on a regular basis, but others won't. So take care.
Take care all.